When I have to go to the doctor, I have what is called an Ohip card, Ontario Hospital Insurance Plan.
We have a health card that we carry around. It expires every 5 years. We renew it just like a driver's license. And that's pretty much it.
Basically, if you get sick, you go to the doctor's office, whatever doctor you choose on your own, go to the doctor, give them the card, and then the doctor bills the government for your appointment or whatever treatment you need.
I don't have to worry about anything when I go to a hospital or go to the doctor's. I don't have to worry about a bill. I don't have to worry about not being able to be covered or being asked to leave because I don't have insurance.
In Canada, we have an amazing system where if you pay your taxes, and even if you don't pay your taxes, you will never be turned away. We have a basic, and it's quite deep, the basic plan that's always covered.
Not all medications are covered. Dental is not covered. Not all optical stuff is covered. Some of them are. There's all different levels and rates, but most of it is pretty much covered.
I would say that the program is considered a public option because it's everybody in Canada. If you're a Canadian citizen, you have the right to health care.
If you get sick on a Saturday or your kid gets sick on a Saturday, there are clinics that are open all across the city, Saturdays and Sundays, evenings, if your doctor's not there, and those are also covered with the card.
I make the appointment, I go in, I give them my health card, and that would be pretty much it. I sit in the waiting room and then I go inside when they call my name.
We don't have any kind of hospital that is lesser care or lower than any other hospital. They're all exactly the same. You know, I mean, they have different specialties, but in terms of levels of care, cleanliness, overcrowding, any of that kind of stuff, no, it's all equal.
We're kind of let alone, and they try to stay out of our personal business, I guess, as much as possible with providing as much service as possible.
Yeah, myself, I've had a rare case of sinusitis that resulted in 2 surgeries and multiple ambulances and 2 weeks staying in the hospital, and yeah, I've never had to wait for anything.
All employed people, there's a bit of a tax on all employed people, and we pay into Ohip.
We're paying the taxes. That's where the money is going to healthcare. And yes, we are privileged to have that, but at the same time, it's my body. They shouldn't have to tell me what I can and cannot do.
The government pays for that. I mean, I don't have to pay for it out of my pocket. I mean, it's part of our taxes, of course. But I don't have to pay when I go to the hospital for anything, or the doctor.
Our doctors are paid differently. They're not paid privately. So our GPs actually get paid by the government.
You know, it's socialized and it's built in through the tax system. The people who make more money at the top take care of the people at the bottom so that everybody can share the benefit of socialized healthcare. You know, it really sinks in that you never know when you're going to be hit with something and when it's your turn. You know, in the days when cancer comes 1 in every 3 people, it's more important now more than ever to adopt that mentality and be grateful to have that system put in place where you know everybody's taken care of on a basic level for their health to survive.
Everyone should be treated the same, and whether they got money or not.
I can't imagine what it would be like to have to worry that if a member of your family was ill and had to have a lengthy hospital stay, that you would lose your house, lose everything you had because of it.
I couldn't imagine living in the States and thinking that your house is going to be taken away because you don't have health insurance and because you can't afford it. That's just crazy to me. I could never imagine having to go through that.
You can work your whole life and, you know, have your equity, and something can happen and then you can lose it all because you have medical bills. Or in a worst case scenario, you get something like cancer or something like AIDS or something terminal, or even, I'm sure, as simple as Crohn's disease and things like that, things that just need treatment, or even diabetes. And then you are now, I guess, on the hook to cover all that stuff.
It doesn't seem like a system that is engineered or geared towards helping people. It seems like a system that's controlled by money interests and really hurts a lot of people.